Good morning, everybody. This is Dr. Jessica from Radiant Life Chiropractic in Edmond, Oklahoma. Today, we are going to be discussing 8 things you should know about prenatal chiropractic care. Okay, first off, congratulations on your pregnancy. If you were pregnant and watching this, what an exciting time. So the first thing that we're going to be talking about is why. Why should you search for a prenatal chiropractor during this time? What are the benefits of it? So in this line of work doing prenatal care, we hear all the time how the adjustment and muscle work can help reduce low back pain and reduce round ligament pain that you might be feeling. And of course, this is extremely important. But you got to remember, just because you are pregnant does not mean you should be in pain or uncomfortable all the time. And the benefits of prenatal chiropractor extend well beyond just providing you pain relief and allowing you to be more comfortable. So the why behind finding a trained prenatal chiropractor is to maintain proper pelvic and spinal alignment and maintain proper muscle health and tone throughout your pregnancy and reduce tension in the round ligaments. It provides an optimal environment for the growing baby and it prepares your body for labor and delivery. Getting prenatal chiropractic care or chiropractic care in general throughout your whole pregnancy can also help aid in recovery during the postnatal period, which is extremely important considering that you're going to be losing sleep after having a baby, and so we want to give your body the best chance it can to heal. And the second thing we're going to be talking about is how to find the right provider for you. It is extremely important that you are comfortable with your doctor during this time, that they fit within your birth team. Everybody is on the same page with what you want because this is truly your journey. So building a birthing team that supports your decisions and the type of birth you want is extremely important. Not all chiropractors are trained in providing prenatal care, and not all are Webster certified. So when building your birth team, you should in a way shop around for a chiropractor that is trained in providing the specific services or the specific prenatal care that your body needs, including being Webster certified. So a practitioner that is Webster certified has additional training caring for you during pregnancy. So it is something above and beyond that we get in just general chiropractic school. So I, in our office, have 3 years of additional training in prenatal, postnatal, and pediatric care to give you a little idea of what the education difference is. And I am certified by the Academy of Family Practice for prenatal and pediatric care, and I'm also Webster certified. So it really pays to shop around and find the provider that, one, does the techniques, the adjusting techniques that you're comfortable with, is Webster certified, has experience in treating pregnant mamas and helping you recover in the postnatal period. The third thing we're going to talk about is what exactly is the Webster Technique. I know I've already mentioned it a couple times and a lot of people aren't familiar with it. So a chiropractor that is Webster certified has gone through additional educational training in prenatal chiropractic care covering the Webster Technique. So in my opinion, the Webster Technique is one of the most important treatments that you can receive during pregnancy. So the Webster Technique focuses on releasing tension in the round ligaments, the sacrotuberous ligaments, and so it really, during the course of your body change through pregnancy, these ligaments can get really, really tight, and the purpose of the Webster Technique is to help release this tension that gets built up. So the purpose of the round ligaments is to hold the uterus in place. So as your body is rapidly changing during pregnancy, these ligaments can get strained. As baby's kicking and moving, it's moving your uterus everywhere. This can cause tension in those round ligaments. They can tighten just like a muscle can. So by using the Webster Technique, restrictions found in the round ligaments can be released, allowing the pelvis to remain more balanced. Okay? And the fourth thing that we're going to talk about is timing. When should you start prenatal chiropractic care? I always tell my patients, taking care of your body sooner rather than later is always the best approach. Why wait until you are in pain? Say during early pregnancy you feel great. Why wait until that pain starts? Get ahead of it and start taking care of yourself now. So being in pain is never normal. I see prenatal patients usually once a week until the symptoms are under control, and then once that happens, treatments usually occur every other week until around 30 to 32 weeks, where we'll reevaluate at that point. And how are you doing with the adjustment? Are you holding it well? Do you feel like you need care more often? Are you great at 2 weeks? So it's whatever your body needs. So around that 30 to 32 week, we do another reeval and kind of see where you're at. Okay, the next thing we're going to talk about is this safety. So is getting adjusted safe during pregnancy? And I will tell you, being adjusted during pregnancy is completely different than being adjusted when you're not pregnant. It is extremely gentle, and most moms love it. They say it's the best thing ever, and so especially laying face down on the pregnancy pillows. And so it is extremely gentle to get adjusted while pregnant. So chiropractic care has been shown to be safe and effective for the treatment of musculoskeletal complaints during pregnancy. So getting adjusted during pregnancy, like I said, is extremely gentle, and this is due to the relaxin hormone. So your joints move much easier and with much less force or pressure. Many different techniques can be used to adjust your spine, and I can adjust each of these options with you, and you can pick whichever technique that you are most comfortable with. And pregnancy pillows will also be used. So that's a sweet little pillow with the middle cut out, and so you can lay face down and baby can lay safely in the middle of that pillow. So most women love laying on the pillows because they haven't laid on their stomach in months, so you probably would like that option. There are many options available, and we can always find something that you are comfortable with. So services. What services do I provide to my prenatal patients that may give you an idea when you're searching for your prenatal chiropractor? What services should you be asking for? So as a chiropractor, the adjustment is the most important service that I offer my patients, but I also like to take a whole body approach. So I spend a lot of time performing muscle work with each of my patients in conjunction or addition with the adjustment. So think about it this way, the muscle attaches to the bones. So it is extremely important to make sure that they are healthy as well as the joints, okay? So muscle health is huge during pregnancy as the muscles are constantly being stretched and strained during this rapid time of change. And so make sure you find a chiropractor who does do muscle work along with the adjustment to help you hold your adjustment a little bit better. It'll help give you more relief. And we also, in our office, we also use rock tape. So rock tape provides an extra support. I love to tape my patients during pregnancy, and especially when they're having a hard time holding their adjustments and need that little extra support and stability. So each patient goes through pregnancy exercises and protocols, and I put together a very simple at-home exercise program that you can do with just you and the floor. You don't need any special equipment for it, and I target the muscles deep down on your core, the ones that you're going to need during labor. And this is also really beneficial to help prepare you for labor, delivery, and to help you during the recovery phase as well. So services that I do offer my patients, I do adjusting, I do Webster Technique, muscle work, we work on strength building during pregnancy, and I use a lot of rock tape to tape my mamas up. So look for services that you feel like your body are going to need when you're searching for your prenatal chiropractor. Common symptoms that I see during pregnancy, I see a lot of mamas with low back pain. It's probably the most common symptom that I see. And as your body shape changes, strain is being placed on your lower back, resulting in tight muscles. Misalignment of the spine is normal during this time as the curvature of your spine changes. And this can result in sharp pain. It may be dull and achy pain. Another very common symptom I see is sciatica. Sciatica is not fun for anyone, but it seems to kind of flare up during pregnancy. So this type of pain may start in your low back or your hip area, and it may result in pain, numbness, tingling, maybe even some muscle weakness going down one or both of your legs. So this is often caused by misalignment and tight muscles that are irritating your sciatic nerve. Okay? This can be managed pretty easily with adjustments and doing that muscle work that we talked about, really working that muscle out that's irritating that nerve. And also we could start you on very gentle strengthening exercises, so hopefully the sciatica won't flare up later during pregnancy. Pubic bone pain is another one that I see often, and this is no fun for anybody either. It can be very painful, especially whenever you are trying to walk. This is going to be pretty severe pain down low up front, and you will feel it mostly when like getting out of bed, getting in and out of your car, maybe walking. Round ligament pain, of course, is everybody's issue as they get further along in pregnancy, and so it is probably, besides low back pain, the most common symptom that I do see, and this is where we would use the Webster Technique to help alleviate that round ligament tension. Another common symptom that I do see is carpal tunnel symptoms crop up, especially as you start to get the swelling in your wrist towards the late end of pregnancy. It can put compression on that carpal tunnel, irritating those nerves coming out. You'll get numbness and tingling in your hands. So chiropractic can help with that. We can help push that fluid out. We can also use rock tape to help give you support during that time as well. And the last thing that we want to talk about today in this webinar is postpartum care. So when you think about it, the female body is truly amazing. You carried, labored, and delivered another human. This just blows my mind whenever you think about it. So your body goes through major changes during pregnancy and delivery. Now it is time to heal. Give yourself some grace and love during what is called the 4th trimester. So during delivery, pelvic misalignment may result in dysfunction, it may result in pain and discomfort. So caring for your new baby brings on a whole new physical demand that your body has to adapt to, including nursing, pumping, carrying your baby, sleeping in odd positions, toting around a carrier and diaper bag, losing sleep. I mean, the list goes on and on. So getting chiropractic care following the delivery of your baby can help ensure that your body is free of dysfunction for optimal healing, but plus so you can be the best version of yourself for your new baby. So building your birth team with like-minded birth providers is so important to support you during pregnancy. So finding the right prenatal chiropractor is no exception. Do your research. Choose the provider that offers the services that you need, and choose a provider that you feel comfortable with to go along with this journey. And thank you for listening, and let me know if you have any questions at all about prenatal chiropractic care or how to find one near you. Thank you.